Racism in the Healthcare Industry by Nathan Cowley, Jack McCarthy, Ty Trickle, and Dominic Lund. Next. Racism has been a long-standing issue for millennia, affecting countless lives. While racism isn't as a prevalent issue today as, say, 100 years ago, it is still alive and affecting millions in modern-day society. One example is in the healthcare system. Many today are facing the issue of not having health insurance, and the groups with the highest number of uninsured people are in the minority categories. As you can see here from this graph, people who didn't go to the doctor since 2018, white was one of the lowest categories, with minorities having with higher categories. But that shouldn't be the case, because white makes up 60% of the people in the country, and with many below the poverty line who don't have health care, and black and other races are higher are lower the poverty line and have all right, next. I'm done.
Next. So the problem of racism in healthcare has two major parts: racism towards patients and racism towards medical professionals. It is one of the biggest, if not the biggest, problem in the healthcare industry. This is because of the fact that many doctors and patients are mistreated because of racism, whether it be that a patient asks a doctor for proof of authenticity, or doctors misdiagnosing patients due to implicit bias and/or racial discrimination. Associate Professors Dr. Brian Rasmussen and Ann Guerin, PhD, stated that examples of such microaggressions might include questioning where the practitioners received their degree, what country they were born in, or whether they were being supervised. This shows racism towards doctors because their patients do not believe that they are certified doctors just because of their skin color. Patients are also more distrusting of doctors of color when compared to white doctors in a study conducted by Katrina Armstrong, Karima Raven, and Suzanne McMurphy, who were with the Department of Medicine and University of Pennsylvania at the time of the study. Next. Patients of color and minority are mistreated by biases because even medical professionals have biases. Three major examples of this are the people of color, mainly African Americans, are at higher risk of dying from common diseases such as strokes and cancers. African Americans have a shorter lifespan than the average white American, and African Americans have been mistreated by practitioners because of racial biases that cause the doctors to associate problems of new patients to those of old patients because of skin color, and that could lead to misdiagnosis of patients. All this information was found in an article by Tanya Russell, a freelance journalist who has written for many news sources such as BBC. Next. An article written by Timothy Cunningham, a Harvard-educated epidemiologist who has worked for the CDC, stated that even though the racial gap has narrowed since 1999, in 2015, the death rates were 851.9 per 100,000 blacks and 735.0 per 100,000 whites. This shows that racism towards patients by doctors can affect their health because they could get misdiagnosed by doctors due to bias. Next. The impact of racism in the medical field is that doctors of color are attacked and insulted by patients due to skin color, and that patients are misdiagnosed due to racial biases by doctors, which could lead to health problems or even death. Next.
Now moving on to our first solution, which is implicit bias training. According to Amy Zayden from the Emory University Department of Emergency Medicine, the research has shown that the rates of implicit bias among the medical community, as measured by the implicit association test, are equivalent to that of the general population. This graph here shows that up to 30 to 40% of physicians have a strong pro-white implicit bias. Implicit biases are a serious problem that is incredibly prevalent in the medical community today. Next. Implicit bias training would educate physicians and medical students on the existence of the implicit biases, as well as reduce the effects of these biases on healthcare. William J. Hall, the assistant professor at the School of Social Work in the University of North Carolina, states that interventions targeting implicit attitudes among healthcare professionals are needed because implicit bias may contribute to health disparities for people of color. implicit bias training intends to eliminate these biases, which, as William J. Hall states, are related to patient-provided treatment, interactions, treatment decisions, and patient health outcomes. Next. Some limitations of this solution is that providing training to recognize and reduce implicit biases does not necessarily mean that they eliminate these implicit biases, as some physicians' implicit biases are unaffected by any sort of training. In some cases, there has been even little evidence to support that implicit biases have any sort of relation to health outcomes. So providing this treatment anyway in the first place would not cause any change in the quality of medical care. In fact, implicit biases are not the only cause of discrimination in healthcare. Explicit biases also exist, as they are conscious biases, and these biases can also affect the health of minorities, which implicit bias training will not correct. Next. The implications of providing implicit bias training would allow physicians to provide medical care as their subconscious biases would not be affecting the decisions regarding healthcare. Irene Blair, researcher at the Department of Psychology and Neuroscience at the University of Colorado, states that clinicians with greater implicit biases against blacks consistently are evaluated as providing less patient-centered care. Providing this implicit bias training would allow clinician relationships to be better, as implicit biases that affect patient-physician relationships would be reduced. Next.
For a second solution, to ensure that there is no cultural bias, doctors and patients should be able to select the cultural background of the doctor or patient they will be seeing, or at least be made aware of their cultural background beforehand. Next. Two quotes. There is a need for research and political will to invest in African minority health and a diverse workforce that understands the background of the African population, and action to address structural and institutional racism and white privilege to address root causes of inadequate access and care processes for ethnic minorities. That was by the researchers Blessing Kanangoni, Sari Adenahaji Sutjaho, and Eleanor Holroyd. Next quote, if we can create a sense of belonging no matter what your cultural background is, that will speak volumes, and people will talk about that feeling, Mitchell said. And then you won't have to worry about the numbers because you'll start to see that change, by Megan Caruso. These two quotes show that we need more doctors who understand the cultural backgrounds of their patients so that we do not run into any issues in healthcare. Next. The limitations of the solution are, the first limitation is that it could result in other issues such as segregation. Wait, no, this is wrong. Well, the first limitation is that patients may not have enough doctors willing to see them, and vice versa. If doctors were able to select the cultural background of the patient that they will be seeing, too few doctors may select a certain cultural background, resulting in people of that cultural background not having enough people to go to, and vice versa. If a patient did not, if not enough patients specified a doctor of a certain cultural background, that doctor could eventually end up being put out of work. Next. The next issue is segregation. Doctors may end up refusing to help a certain person because of their cultural background. Hospitals could end up being split into sections for a specific race, which would undo much of the work that has been done over the past several years. Next. The third limitation is that some people may be against the idea of selecting the race of their doctor or patient, so they may refuse to specify a preference, or they may not go to a certain hospital, causing this to be difficult to implement. Some hospitals may, if not enough people go to these hospitals, those hospitals may run out of work and end up closing, or like they may be boycotted and end up closing. Next. The implications of the solution. This solution may not be able to remove racism, but it may be effective in preventing people from being racist by removing the opportunity for them to be racist. As previously stated, some people may be harmed because they do not have enough doctors willing to help them, or patients willing to see them. The people who will be helped are those who have enough doctors or patients willing to see them. This could cause certain minorities to not have enough doctors willing to see them, who should not provide much progress in this issue. This solution could remove cultural bias from healthcare and could even get cultural bias to work for people instead of against them. If a white man, for example, if a white man wants to see a white doctor, then any present cultural bias would only help them instead of hurt them. Next. Oh, sorry, I should have said next earlier. Next again. Finally, the solution is realistic because it would not be very difficult to ask a patient if they have any preferences about which doctor sees them, and it would even be easier for a doctor to specify a specific race they would like to treat. Next. The first solution is the best solution that we came up with because it removes racism instead of just covering it up. If doctors are trained to not be biased, then many doctors will not be racist, and if everyone has implicit bias training, this would work towards removing racism forever. Implicit bias training and other techniques are aiming to reduce the discrimination in the healthcare industry at its core in many different ways. According to Colin A. Zescott, assistant professor of psychology at the College of St. Scholastica, finally, the ultimate goal of training providers to reduce implicit bias is to reverse the disparities in care that many stigmatized patient groups receive. The goal of implicit The goal of implicit bias training itself is reversing healthcare discrimination and racism in providers that affects the care. Additionally, John F. DeVito, professor of psychology and public health at Yale University, states that recognizing that these biases exist, understanding the complex and reciprocal effects of these biases on providers and patients, and developing new interventions to combat these effects are necessary to eliminate the inhumane justice of which Dr. King spoke of disparities of healthcare and health. The recognition and reduction of these biases is a necessary step in eliminating racism or the inhuman justice in healthcare. The second solution would be easier to implement and would provide a greater chance that doctors would not poorly treat patients and vice versa. The implicit bias training would actually remove racism instead of just going around and covering up. If patients and doctors could choose the race of the person they are seeing, this could result in racism because people would still refuse to see certain people because of their race. If people go through implicit bias training, people could still be racist after going through this, but it would be better for removing racism instead of just ignoring it and putting a band-aid